In Reno, you're watching 2 News at 6:30.
Staffing, however, remains a constant concern.
The COVID-19 surge is taking its toll on our hospitals, and deaths are also on the rise. Continuing coverage of the coronavirus pandemic tops 2 News at 6:30. Good evening, everyone. I'm Ryan Canada. Thanks so much for being with us tonight. Well, today, Nevada Health Response reported a record 48 new coronavirus deaths statewide. COVID-19 cases are continuing to spike across the state. State health officials are reporting around 2,000 cases per day, and the state's 14-day test positivity rate has risen to more than 18%. And it's not just a problem for larger counties. Look at this map. According to Nevada Health Response, 16 of Nevada's 17 counties are currently flagged for elevated transmission risk. Story County, that little one you see there in blue, is the only exception right now. Most are for increased cases and positivity rate. Now, in the last month alone, the number of Nevadans hospitalized with COVID-19 has almost tripled to more than 1,500 people. The rise in hospitalizations was one of many topics in today's state COVID task force meeting. Paul Nelson followed today's meeting and reports that while officials say most hospitals have the space for more patients, they don't necessarily have the staff to take care of them.
Many hospitals in Nevada are using outdoor triage tents to handle incoming patients with respiratory illnesses. Renown is also using its alternate care site for COVID patients on the mend.
The hospitals are feeling the strain, but are currently managing the crisis and the stress.
Staffing is another concern. Nevada's hospitals are competing for traveling nurses. Lake says each one of them costs $180 to $200 an hour.
We had a nursing shortage prior to COVID. I just want to put that out there. So we started from a deficit. And then we have the increase in patients right now.
Some staff has to call in sick or quarantine too, adding to the shortage. Some hospitals have decided to postpone some surgeries during the surge. Personal protective equipment is stable though.
Many of the larger medical centers are reporting that they have an excess of a year of available PPE on hand.
Hospitalizations and deaths are both on the rise, but the number of patients in the intensive care units aren't rising as quickly. Lake says the reasons for that are hypothetical, but it could have to do with better treatments.
We have learned more and more about what works and what keeps these people out of the ICU. Although we are, like I stated, we are seeing a little bit of an increase in those ICU admissions now.
He says some of the older patients who died of COVID may have skipped the ICU, instead focusing on end-of-life care.
They have no code orders. They have things of that nature that preclude them from going into the ICU. They're taking hospice as an option, things of that nature.
Covering the story, Paul Nelson, 2 News.